We've seen how NHS staff have worked tirelessly over the past few months and how they've sacrificed their own health and mental well-being to do their jobs. We know they've supported each other, but how are you, as the government, going to support them mentally?
We recognised quite early on that we were going to need considerable support for NHS workers, and we put in place at the end of March a helpline for staff which is fully confidential, which also gives them 3 offers of one-to-one counselling and further ongoing support should they need it. There was also the launch of a service called Frontline, which was with the help of the Prince's Trust and Mind and other charities, again, to give that support, confidential support for NHS staff should they need it. But, as you heard in your package, the most important support comes from peers and from that debriefing at the end of the day, from the trust they get from the support they get from their immediate trust, so that when something happens on a particular shift, they can debrief, talk to their peers and their colleagues and offload there and then before they take it home with them. And that's as important as having all the helplines and all the counselling in place too.
Now, we're all dealing with this crisis, and the Royal College of Psychiatrists is predicting a huge rise in demand for services as we get through the pandemic. How's the government going to ensure that that's delivered?
Before this crisis started, the Prime Minister gave mental health £2.4 billion, and we already had in place a plan, a long-term plan, and an infrastructure for mental health services to bring them up to a gold standard service across the UK. What we've done is we've accelerated everything that was in that plan to make sure it's in place. And now almost the entire country is covered by a 24-hour mental health crisis helpline, which I know is working tremendously well. And we've help in schools. We've given £5 million to local charities to assist. We've got everything in place to deal with what will be coming down the track at us in the future. And it's important to mention, with post-traumatic stress, which is what we're all going to be experiencing to some degree or another going forward, it's important that, on the Royal College of Psychiatrists is absolutely right, it's not now when people are going to benefit from or need the help, because it's too raw, it's too soon. It's actually later down the tracks, and my job is to make sure that we have those services in place, and I'm absolutely confident that they're there now. And we are going to announce even more measures going forward over the next few weeks to support local charities, local mental health services. It's there, and it's important to mention as well that throughout this crisis, none of our mental health services have ever closed or been withdrawn. They've been there throughout, which has been tremendous.
Now, the theme of this year's Mental Health Awareness Week is being kind, and that is especially true on social media. You're the Government Minister for Mental Health, and so you have to lead by example. So what do you say to people to take you seriously?
Yep, social media, it's, particularly affects young girls, young men. We, as politicians, we put ourselves out there in the front line of very combative political atmosphere. I don't think that's ever going to change. My concern about social media and trolling is the effect it has on young people who don't put themselves out there and who can be affected, whose perhaps a lack of self-confidence can become something that's far worse, that can become anxiety or depression, and can linger and can become something else that affects them for life as a result of what happens on social media. So in terms of the mental health context, that's where my concern is, in our young people who engage with social media every day and how that affects them and how it can have an impact on life. And that's where I think our focus should be. And we've been working with organisations like Instagram and Facebook and Twitter to try and do something about that. But, the focus really on social media needs to be on our young people, almost all of whom engage in it.
But we look to our politicians to lead by example, and being kind is really important, isn't it? And it can be any age group that affects. And I think that's what people want to hear from you, about how you're going to convince them that you are genuine as well.
Well, I think people only need to look at, I think most people well, certainly my followers. As an MP and as a female MP, female MPs do get it much worse than I think anybody else. I think we take a huge amount of abuse on social media, and I think the important thing to do is that we make sure that on social media we do set an example.
10 years ago, we wouldn't have had a Minister for Mental Health or perhaps cared in the same way as we do now. Do you think society needs to change now? Perhaps we ought to have daily or even weekly mindfulness sessions as they do in other countries.
You know, we never had a Minister for Mental Health before, but then society wasn't structured as it is today. We didn't have 24-hour kind of a rolling society with social media and a fast-paced life and all that comes with that now. And I think we need to stop really asking some fundamental questions about how we live our life, because it's obviously having a mental health impact on people. And I think that's where we really need to focus our attention. I hope that, you know, if there is anything good to come out of this crisis, the re-evaluation of life and the pace of life and the way people conduct their lives will be something they may change. I know there's been a huge, people have been very concerned about the environment and actually can see the impact that lockdowns had on the environment. I think it's had the same impact on people evaluating their lives and realising what is important. I hope in turn that will have an impact on people's mental health.
Nadine
Okay,
Dorries, thank you very much for joining us.
thank you.